information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, don't forget to like the video and subscribe to the channel for support. Belonging to a group of drugs known as statins, Crestor's active ingredient is Rosuvastatin. For oral administration, Crestor is available as 5, 10, 20 or 40 mg tablets. What is Crestor and what is it used for? Crestor is a prescription medicine used to lower LDL cholesterol and triglycerides in the blood, slow the progression of plaque in the blood vessels, reduce the risk of stroke and heart attack. Crestor may be used alone or with other medications. Crestor works by reducing the amount of cholesterol made by the liver, lowering bad cholesterol and triglycerides and raising good cholesterol decreases the risk of heart disease and helps to prevent strokes and heart attacks. How to use Crestor? The dose range for Crestor in adults is 5 to 40 mg orally once daily. The usual starting dose is 10 to 20 mg once daily. The usual starting dose in adult patients with homozygous familial hypercholesterolemia is 20 mg once daily. The maximum Crestor dose of 40 mg should be used only for those patients who have not achieved their LDL-C goal utilizing the 20 mg dose. Crestor can be administered as a single dose at any time of day, with or without food. The tablet should be swallowed whole. The dosage is based on your medical condition, response to treatment, age, race, and other medications you may be taking. Antacids containing aluminum or magnesium can reduce the absorption of this drug. If taking this type of antacid, take it at least 2 hours after this medication. Take this medication regularly in order to get the most benefit from it. Remember to take it at the same time each day. Keep taking this medication even if you feel well. Most people with high cholesterol or triglycerides do not feel sick. It is very important to continue to follow your doctor's advice about diet and exercise. It may take up to 4 weeks before you get the full benefit of this drug. Precautions to take before using Crestor. Before taking Rosuvastatin, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of liver disease, kidney disease, alcohol use. Before having surgery, tell your doctor or dentist about all the products you use. Limit alcoholic beverages. Daily use of alcohol may increase your risk for liver problems, especially when combined with Rosuvastatin. Older adults may be more sensitive to the side effects of this drug, especially muscle problems. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Discuss the risks and benefits with your doctor. This medication passes into breast milk. Because of the possible risk to the infant, breastfeeding while using this drug is not recommended. Consult your doctor before breastfeeding. Possible side effects that may occur with the use of Crestor are headache, myalgia, abdominal pain, asthenia, nausea. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was helpful for you, for support, like the video and subscribe to the channel. Share your opinions and experiences about the drug in the comment section. I wish you healthy days.